Hi, everyone, and welcome to another episode of Thriving and Change with Dr. Norcott. Today, I'm joined by my really, really good friend and colleague, Dr. Kenise Herring. Hi, Kenise.
Hi, Dr. Norcott. It's an honor to be with you.
I was wondering if we could start with you sharing a little bit about the work that you do.
Yes, ma'am. I am a clinical psychologist, and I have, for the duration of my career, principally maintained an outpatient office psychotherapy practice. I see people with substance use disorders. I also do some consulting work in substance use disorders. And I see people with anxiety and mood disorders. Those are like the three areas of specialty that I enjoy working in.
And in addition to being an amazing psychologist, I remember when I was thinking about moving to Chicago, you we were at a conference together and you welcomed me with open arms and you said, if you ever show up here, look me up. And I did. And it's been a friendship for 10 years now, for over 10 years now.
I remember you in that presentation.
Well, so I just want everybody to know, as an amazing psychologist, you're just as amazing person and friend. So thank you for joining me. Whenever I have an issue or something comes up that I would love some peer supervision on as it relates to substance use disorders, I think of you because you have a lot of extensive experience with that. Can you kind of root us in an understanding of when people's relationship with alcohol or other drugs gets unhealthy? What does that look like at the start?
It's a dilemma, and especially these days, right? Alcohol's legal, and so we've always had to figure out when drinking becomes problematic. Mm-hmm. Cannabis is accepted socially more than it ever has been. And whether you and I might like it or not, people are using cannabis. We're having a hard time convincing them that they shouldn't. And so some guidelines I follow when you initiate use with these drugs matters. So those of us who start drinking at 15, 16, 17, those are huge red flags. We may not see it because we're 15, 16, and 17, but any adults who have any influence over those kids should be terribly concerned because you're putting a drug, a psychoactive substance, into the body of a developing brain. I think the data supports the same thing about cannabis. And I'm always alarmed to hear that so many high schoolers are introducing cannabis earlier and earlier, 9th, 10th grade. So that's one area when there's early onset. For those of us who wait and start at 21, we got to remember the brain isn't fully developed yet. And a lot of people don't take that terribly seriously because people are driving, people can go to war, people are coming out of college. But we look at those guys, and you'll remember this probably. We used to say those of us who could drink people under the table are the people we want to keep our eye on, because the thinking used to be something doesn't happen that alerts those people they've consumed too much alcohol. And so I still look at a variant of that. Those of us who are drinking heavily daily. And what does heavily mean? That probably means binge drinking. What's binge drinking? 4 or more drinks for women, 5 or more drinks for men, at a club or at a bar, after work, several times a week. We're going to be concerned because the relationship has gone beyond something that's a fun social lubricant, a fun thing we do with people, to something that we seem to rely heavily on to do these things, even if we don't experience ourselves as relying on it.
I talk a lot about relationships and I work with my clients around relationships. And so the question I asked you was about the relationship between the person and alcohol and other drugs, because just like a toxic or unhealthy relationship with a person, people can have that same dynamic with a substance. And it's this idea that, when we're looking for red flags with people, we're saying, if you're in relationship with somebody and they don't want you to be in relationship with other people, that's a red flag. And similarly, people can get so isolated around their drug of choice that they're not doing the things they usually do. They're not seeing people that they're usually seeing because they're consumed with acquiring or using the substance. And so it's interesting to kind of hear you talk even about, if they start earlier, they're going to have more trouble later, because if you have an unhealthy relationship earlier, that kind of bodes poorly for later on in life. So really, I'm seeing so much overlap here.
Look, I love what you said about early onset. If you're 15 dating a 25-year-old, everybody is appropriately alarmed, right? So why aren't we appropriately alarmed if you're 15 and throwing shots? I am flummoxed, and I do mean that. No hyperbole here. When parents say, well, the kids were over, so I let them have shots. Why? So yes, you wouldn't, if the kids were over, you wouldn't let a group of 30-year-old men go in them with them and have their way. And to your point, the relationship with alcohol should be no different than the relationship with any other beverage. Something that tastes good, something that's pleasant, because it's a psychoactive substance, it's going to give us a certain feeling, typically one of disinhibition. But for that relationship to become, as you point out, the primary relationship, the reason that we're getting up and barely getting through the workday because we're preoccupied with ideas of drinking. I love this one. Well, it's 11 o'clock. It's brunch time somewhere. Here's a mimosa, 3/4 champagne, a splash of juice. Now, that's not to denigrate the boozy brunches. But when the reason for the brunch is the mimosa and not getting together with friends, we want to be concerned. But it's really hard, as you know, to get people to reflect on that relationship with alcohol as cause for concern. And I'm certainly more seasoned than you as a clinician, but when we seasoned clinicians say it, people say, well, that's because you're old. It's like, well, yeah, but I can still drink. You won't get to where I am and have a relationship with alcohol if you continue drinking like that.
But I do think that it's more, because I work a lot with adolescents, and you work a fair bit with adolescents as well. And it's almost more palatable not to say it's bad for you to smoke weed or it's not good for you to drink a lot, but to say your relationship is not doing you any favors. You're not using to have fun. You're using because you're overwhelmed with anxiety. Right.
And I don't know how much luck you have with that. That's a tough population for me because, and I tell me what you think. I think that when a 14, 15, 16-year-old starts using weed every day to go to school, something's wrong. And so when I say, we got to look at this, they can't hear me. And I think part of the reason they can't hear me is because I'm suggesting to them that they stop a relationship with the one thing they're convinced helps them get through the day. And so the early onset adolescent drug use is a real challenge.
But I think something that undermines that too is when we suggest pharmaceutical medication, like pharmaceuticals, because you're saying, okay, so then it becomes this, why is this one better than this one? So I think that really complicates the
You really do treat adolescents, don't you? Because you have to answer those.
Because you have to answer that, right? You have to say like,
weed at least is natural. You're telling me to take this. Well, this is a whole other topic, but that's an argument for a very different kind of relationship because something's gone awry in some other primary relationships. And there's an opportunity to develop a whole different relationship, but another time.
But, to at least touch on it, because that is complex, because, oftentimes people are like, well, why would you prescribe something or suggest somebody talk to a psychiatrist and not suggest that they use marijuana to calm their nerves before school? I think my approach, at least in the beginning, and at least for many kinds of the most common presentations of depression and anxiety, is that you're born with what you need to take care of yourself and manage your mood and anxiety. Some people have to exert more effort to do so, but you don't necessarily have to smoke a substance to manage your anxiety and worries. There are strategies that don't involve consuming something. And that involves shopping, that involves food, that involves alcohol. That's kind of the approach that I take. I'm wondering kind of what your frame is, especially when you're working with young adults, teenagers.
You probably work more with younger kids than I do. My work is with late adolescents, and that's by preference. It's complicated, and occasionally I will take a 16-year-old. But as you know, I work with a lot of young men in emerging adulthood. So a part of my work has been for years as a case manager with the NFL substance abuse program. And that point you raise about, well, at least weed is natural. You're telling me I should take prescription pain medication when weed helps me feel better. That's a tough one to argue with. And I can give all of the regulation arguments. Prescription pain medication is regulated. We've observed it, da, 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 da. It's a bright and informed group about cannabis. And as you also know from other relational work, we cling desperately to relationships that mean a lot to us. They can be awful for us. Mm-hmm. We're going to guard them tenaciously when people begin to attack them. You know, quick sidebar. My mother used to always say her thoughtful wisdom about boys she'd prefer me not seeing was that she had to go along because the minute she didn't, I was going to cling to them more tightly. And she's right? Mm-hmm. And so when young men present this whole business about being born with everything you need, I think I agree, and then maybe I see it a wee bit differently, because sometimes I think we're born with systems that are a little bit off kilter and that have not been looked at thoughtfully for a host of reasons, particularly among kids of color across school. And so academic difficulties aren't looked at as possible reflections of other kinds of neuropsychological differences. And so you find lots of kids using weed just to settle down, when maybe strategies will work, mindfulness and other things, but there may really be attentional difficulties, and these are complicated, that require some augmentation. So that's how I think about it.
I want to just interject because I want to just check in. It sounds a little bit like you're saying there's something about kids of color where their executive functioning or their brain chemistry might be different. Can you just say more about what you wanted, like what you mean by that?
Yes, I certainly don't mean that at all. So thank you. Nope. I think kids of color often get received differently than other kids. So for instance, there could be you and a Euro-American kid, and you could be quite busy and that other kid could be quite busy, and you could be disruptive and that other kid could be disruptive. Regretfully, there is this almost implicit bias that you and your behavior are more problematic than her behavior. And I think we see that a lot with boys, especially athletic boys and big Black athletic boys. And so, no, I'm not talking at all about brain differences in kids of color. I'm talking about the social response to kids of color.
Oftentimes we're talking, especially in psychology, about, walking this line between talking about environmental toxins, right? So the illness of the environment, and then the issues in which we embody. So sometimes our negative mindsets, our anticipatory anxiety, and we're riding this line and not blaming and shaming people for reacting to a toxic environment. And so I'm glad I asked that, because it sounds like what you're saying is that there's more consequence for busy or agitated behavior for Black kids than there are for white kids often. And so then the imperative to manage that, either from family and society or the individual, to kind of move smoothly through, sometimes rests on whether they can find something that's going to calm them. Does that sound? Yeah.
Okay. Yes. Or help them fit, especially if you're one of a few kids of color in a really good school. I think there are a number of variables that might contribute to a potentially problematic relationship with substances, especially with early onset substance use.
No, I mean, I think this is also interesting, and how we're talking about it, I think, really underscores how complicated it is in the ways in which we talk to people about using substances. I don't think, neither of us want to demonize anything, but we want people to go, I won't speak for you, but I think we're of similar mind. Like, I want people to go into whatever they're doing fully informed and making decisions with the knowledge that they need to make their best decisions.
Yes. No, and I'm loving talking with you because I never get to talk with you about this.
So in thinking more maybe about the older spectrum of the people that we work with and the people that you work with, how has COVID-19 changed the way people have related to substances? Like, what have you seen?
Oh, gosh, not just what have I seen, what have I read, what have I heard? So as you know, alcohol sales are up, so are cannabis sales, but alcohol sales have skyrocketed during COVID. And it makes sense, right? We can't go to bars. And so a lot of us are ordering alcohol. There are places we've learned that will deliver alcohol to our homes. We're becoming really good at making cocktails. Many of us have joined wine clubs, spirit clubs. I read a stat, Corona is the highest selling beer during COVID Corona. But what this lets us know is this time when we're isolated, when we're overwhelmed, when we're stressed. And if we can, for just a minute, let's look at different groups. So if we're a single kind of, adult, early career person who's used to networking, who's used to being out with people, and who suddenly can't do that with impunity, what do? You do lots of Zoom cocktails. I attended a fabulous Zoom cocktail party where they sent me the kit beforehand. So I've got multiple things of tequila. I've got my powdered lime. And there's a lot of that going on. We didn't do that beforehand. If you are a working mom and dad and you're trading off e-learning with 2 or more kids, and then there's still a small one, you can imagine after school ends and work ends, wine, please. And then if you're an older person, and so let's make that older person someone who's retired, but you can't get together with your friends. You can't meet at McDonald's and have coffee. You can't go to line dancing club. You can't do any of the things you do. Wine helps. And there may not even be Zoom. So these relationships with alcohol that were probably pre-COVID socially based relationships, mostly lubricants, frequently with food, but you got to drive home, you got to get home, you got stuff you got to do after you get home, have changed dramatically. And the alcohol, for many of us, has become the balm at the end of a tough day.
And just like the relationship between, or not the relationship, but the boundary between work and home has been blurred, so has the boundary between aid of relaxation, like you said, the balm, and social. That line has really blurred. And the pull of, I think, alcohol as a conduit to connect is so strong, to see people that are risking infection to go to bars still amidst this, because that pull, right? And I think we need to honor that, right? Like there's something that's really, people are yearning for being at home, such that they would risk their health to kind of access it. And alcohol being this like really common player in all of those ways.
I have always found it, and this will sound peculiar, but sad, that people who must refrain from drinking, and you and I both know there are some people who simply should not use alcohol, and many make the decision to abstain. But it's a kind of cruel world they have to navigate because we are so wet, right? And so if you go to dinner, first thing someone says, "Can I get you a drink?" And I both work really hard to tell people, yes, your drink is club soda and lime. Your drink is Coke Zero and lemon or whatever, but some non-alcohol beverage. I have made plugs for mocktails for years, but it's hard. To your point, I think, because we are so wet and because alcohol is such an integrated part of the way we socialize, during COVID, we're going to go back to that because we know it helps us feel just a little bit of ease. No matter how much you or I say to somebody, here's what I want you to do. I want you to now go to your private space and turn on calm and give yourself 10 minutes. It's like, no, I'm popping a bottle of wine, or I don't know if you've noticed this, screwing off the top of a bottle of wine. It's as though the beverage industry has made it easier for us to get to the wine. It's not just cheap wine anymore that you screw the top off of.
Yeah, I mean, there are so many ways I think it's become easier to imbibe, right? There are many people that are using without being mindful about their use. And so before long, it's really been a month and they reflect and they say, I used to only have a glass a week and now I'm having 2 to 3 every day. And so there's something that just becomes, because our sense of time is a little bit more fluid lately being home, that we lose track of that tangible kind of those ways in which we've set up boundaries for ourselves. And I think you were touching on it. There's just more things to be anxious and keyed up about than ever. So if those were our cues to use whatever substance, cigarette, caffeine, what have you, like all those cues are even more present.
I love what you said about mindless drinking. I often talk to people who insist on drinking, who I think shouldn't drink, but ultimately the choice is theirs, about how drinking must be mindful. And so you must pay attention to what you drink. You must savor the taste. Put the wine in your mouth, run it around your tongue, find the different flavors, all of that, in an effort to make people mindful that the moment you start feeling intoxicated, you should stop, because I never want people to drink to intoxication. It should be just another beverage. I am someone who can use alcohol. I don't have an alcohol use disorder, and I feel comfortable drinking. I'm not a big drinker when I'm leaving my house, commuting downtown and coming home, because I get home, I'm tired, I have to cook dinner, I have a different routine. I have been stunned from the perspective of mindfulness at how I think differently about alcohol, walking from my upstairs office to my downstairs kitchen, or around the corner kitchen, or across the hall kitchen, about, oh, I'll have a glass of wine. And that struck me. So thank heavens for mindfulness. It's exactly what you said. I have noticed how quickly the wine bottles pile up in the recycle bin. And so I think it's very easy to become mindless about how quickly our drinking goes from pre-COVID drinking to COVID drinking, and I would argue potentially problematic drinking. The other thing, the relationship with alcohol, the problems develop in this insidious way, right? We look up and one day we realize, my goodness, I have a hangover. I threw up. I don't know how I got home. I mean, these are things that happen over time with chronic alcohol use. And, I suppose having a hangover and throwing up doesn't mean you ought to be alarmed, but I think you ought to be mindful. It's like, whoa, this never happened before and it suddenly happened. Well, what's happening here? I don't think all of it is to ameliorate pathological anxiety or depression. I think some of it is to ameliorate this kind of broad sense of how long is this going to go on?
Yeah. Yeah, I agree. What can people, as we're heading into and in the middle of this winter, coming up to more than a year, we're in our anniversary-ish time because it's so amorphous. If someone's starting to question their relationship with alcohol or other substances or online shopping, anything like that, what are some things that they can notice and then do?
Okay, so let's be mindful about it, right? Let's start there in the most superficial way. So if you have this thought, my goodness, there are 3 bottles in the recycling bin and it's just Friday. So let's track the amount of alcohol we're using for the next 7 days. And when we've completed a bottle, a bottle holds what, 5 glasses, right? 5 standard glasses of wine. If we're the only one completing that bottle and we open it on Monday and Tuesday it's empty, I think it's worth saying, whoa. And then what can we do? I think we go back to the recommended CDC guidelines. So if you're a woman, I think you aspire to have no more than 7 standard alcohol beverages in a week. And for those of us who have slipped into mindless drinking, that's going to be a little tough. Because if I'm having a standard glass of alcohol, and for wine, we mean 5 ounces, while I'm cooking, and then when I sit down to watch the reruns of cable news, I'm having another standard glass, and I do that 7 nights a week. And let's be real, possibly a third one on Saturday and Sunday. I'm already well above the CDC guidelines. So first thing, be mindful and recognize. Second thing, let's reduce it. Now there's one small caveat. If you're having 30 alcohol beverages a week, we got a real problem. And I'm injecting this because neither you nor I can tell someone to stop drinking and be absolutely certain they'll be okay. And so if you're drinking heavily, it's imperative that you get on a telehealth call with your physician and speak with your physician about the amount of alcohol you've been consuming, the length of time you've been consuming it, and the wisdom of stopping and how you stop. And for the audience, the reason for that is that alcohol is a substance on which the brain can rely heavily, and the abrupt cessation of alcohol can lead to medical problems, lethal medical problems for some people. But for those of us who've just slipped into mindless, too much drinking, let's try to keep it within the CDC guidelines.
That's so helpful. And I think the idea of just tracking it. I mean, whenever we want to look or modify a behavior, that's often the first step. It's to just track it for 7 days. And one of the funny things is that when you're tracking, you can kind of fudge it and be on your best behavior for the first couple of days, but you really go back to what you normally would do for that last half.
But then you don't stop it, right? You don't.
Right.
You don't stop the tracking. I love to have what I call, I can't even remember what I call it, but I try not to spend any money for the first 3 months of the year, mostly because I'm recovering from December stuff. And it's fascinating. It's become now a ritual, and I'm very mindful and very intentional about it. And I'm sitting here thinking, I hope I'm not lying. Have I bought anything on Amazon lately? But I'm glad you kept talking about the relationship with shopping, because Jeff Bezos has gotten richer, or Amazon has gotten richer. And heaven knows, we've seen tons of UPS, FedEx, and USPS people bringing Amazon boxes. These have been essential workers just to kind of sate all of our shopping needs. Early on in the pandemic, I think by the fifth thing that came into the house for the backyard, my husband said, now we have an X? It's like, well, yes, we have to create an outdoor room. But it's what you said. When you can't do anything else, your relationship to online shopping becomes a potential problem.
Yeah, sometimes that the consumption and the other to soothe inner, it hops. It can often hop.
And it is consumption on all of these.
Yeah. Mm-hmm. And it's such a Western or just even modern society strategy for soothing what often is environmental toxins, our environmental stressors. What I love most about talking with you, Kanice, is that we challenge each other in such a, and give each other different perspectives in such a professionally growth-oriented way. I always learn so much from talking with you. I love that I find when I talk to my patients and I say some of the things and the ways that you say them, and I'm like, I'm going to use a Kanice term right now.
Oh, Candace, that warms my heart. And it's reciprocal. Whenever I talk about trauma, my Candace introject gets stimulated. And then I think, oh no, is this complex trauma? Is it compound trauma? But I too love these kinds of conversations. And I learn incredibly from you. So thank you for including me in this format. This was fun.
Thank you for joining me. And again, I mean, I just wish everybody could get time to consult with you because you are such a gifted therapist. Thank you for joining us today.
Oh, thank you. And thank you for doing this. You reach so many people. And I think that, and I'm going to stop, I promise. It is lovely that we get to do what we do in our offices, but your ability to reach large numbers of people in this format is invaluable. And I encourage you to continue.
Oh, thank you so much. I really appreciate that. All right. Thank you, everyone, for joining us for another episode of Thriving in Change. Please take care of yourself and take care of each other. Bye.